What should be done for the lower bags and darkness? Relocation, removal, and fat transfer? I've really tried to do my homework on the procedures, and all it has done is confuse me and scare me. I've seen 3 surgeons that have good reviews, and they all said I should do different things. According to what I have read off of this website, I should do what is best for my face anatomy. Looking at my photos, should I do fat transfer with removal of fat pads, or should I do fat relocating? And why? Which one will have the best results? Please help.
Thank you for your question. As you stated in your question, you've really done your homework and you met with 3 surgeons and you're trying to look for the perfect solution for the bags under your eyes. And naturally, to your surprise, there's inconsistency in the opinions of doctors as to what to do. So to summarize, you're asking about removal, relocation, as well as fat transfer. So your confusion is certainly understandable. And when we look at patients, we always look at the anatomy, of course, and we look at the context of their facial aging. I wrote a book a few years ago called The Fine Art of Looking Younger. And I've been in practice for about 20 years and a specialist in cosmetic oculofacial plastic surgery. I do a lot of eyelids, I do a lot of facelifts. And facial aging is something that I really spend a lot of time focusing on and helping people understand the elements of the facial aging process and how any given particular plan impacts on that. So let's just define a couple of things that are issues here. One is, of course, lower eyelid fat prolapse. And with your photo, you clearly demonstrate that. But I also point out to most of my patients who come in for eyelid consultation is to also look at the adjacent area, the area called the eyelid-cheek junction, as well as the area of the cheek or the submalar area. When you have bags under your eyes, it is often the dominant feature, and it's what really detracts from the overall appearance of your face. When people have this type of procedure done, and whatever surgery they have done, and the fat pockets have been properly addressed, then they look at the rest of the face and sometimes think that they look hollow or they look sad. And why? Because the adjacent areas of the face also have aged, but because they weren't dominant, their focus was not there. Now, in terms of distinguishing procedures, as a specialist, I can tell you that in my experience, fat transfer to the lower eyelids is not advisable. I see patients from all over the world who have had fat transfer and they end up with irregularities, lumps, and it just doesn't work. The theory and concept is try to build up and restore the fat that's been lost and try to then camouflage the fat pockets. Well, there are several defects in that idea. What is a problem is the fat that's under your eyes is actually prolapsed forward, so it's like a hernia. Therefore, that as herniated fat, it needs to be addressed in some way to restore it in its proper position. MRI studies have shown that people with fat prolapse actually have more fat. In other words, they actually have an enlargement or increase in fat. Thus, it is justifiable to do procedures where you actually reduce or remove the fat. As far as transposition or relocation is concerned, this is an area that is very often sounds much better than it actually is in practice. Moving fat from the orbit, from the space where it is, and moving it to the adjacent areas may make sense, but a lot of people who get fat transposition will actually not have a good result and will actually have chronic swelling in the area where the fat is moved into that eyelid-cheek junction. So, although in my practice I do some fat transposition, the majority of the patients like you who have all this extra fat, I actually do fat reduction because it is logical to reduce fat that is herniated past the rim and to get that type of contour. Concerns about hollowing and things like that are always addressed, and that is where I think is your confusion, is that why would three different doctors give you three different opinions? Because cosmetic surgery is an art, and it's not a commodity, and it isn't duplicated equally between doctors. Every doctor comes to the table with their aesthetic sense, with their experience, with their technical abilities, and of course with the procedures that best work for them. And there's a lot of finesse in what we do. And that's why you can't just shop doctors like you shop for vacuum cleaners or televisions. You know, commodities that are absolute, you can certainly look for the lowest price and get what you want. But when it comes to medical care and surgical care, it is really more of a gestalt of how you feel in terms of your comfort level with the doctor, with the style, and that's usually demonstrated by looking at before and after results, and then getting a sense of the aesthetics and being in synergy with that. At the end, it's always trust and being comfortable. So in helping you make at least one distinction, I would advise against the fat transfer. As far as resection versus transposition, I think a lot of very good surgeons do a combination depending on what they see. It's similar to what we do in facelifting surgery. When you look at doctors who are promoting facelifting surgery, very often certain doctors will claim they only do deep plane. Well, you know, that's really absurd, because if a person isn't a good candidate for deep plane, they're going to do something else. So they may just say that, but they really are doing whatever is appropriate for the patient. Cosmetic surgery is still ideally about customization. You know, some doctors like to do things a certain way, and they'll always do it the same way. Very often, those are the doctors that get themselves in trouble, because a certain percentage of the patients don't have an anticipated or ideal outcome because they used a cookie-cutter approach. So I think that meeting with doctors who have a lot of experience with eyelid surgery, particularly as a specialty, will probably help you make that decision, but understanding what to anticipate. I think that unfortunately at this point you are someone who has a little bit of information overload, and unfortunately that results in paralysis of analysis for many people, and you just don't know what to do. So understanding that it is a very individual result performed by individual doctors, and that it's your decision to find the doctor that resonates with you and then see through the procedure, ultimately will probably be the most beneficial solution for you. So with that being said, I hope that was helpful. I wish you the best of luck, and thank you for your question.